Welcome to Raportuldegarda. My name is Bianca Cucoș. We are present today in Bucharest for the conference on lung cancer, a priority for the Romanian healthcare system. The latest findings from the Economist Intelligence Unit, a study on lung cancer, were presented today, and I have invited with me Dr. Mary Bussell from the Economist Intelligence Unit, Health Policy and Clinical Evidence. Welcome. Bun găsit.
Bun găsit. Thank you very much for having me here today and for taking the time and interest to speak with me. It's been a thrilling journey and learning more about what is going on in Romania and to be with you and hearing what is happening in Romania has just been a wonderful opportunity.
Let's begin with explaining what is the EIU report. Which are the directions of this report?
The motivation behind the report is to understand that we know that despite all we have, all the new diagnostic and treatment opportunities that we have for lung cancer, mortality and incidence rates are still really poor throughout Europe. So we have been studying a total of 27 countries. Here, there were 11 in the first phase of the report, of which Romania was a part, and there are 16 countries in the second phase of the report, where we are really diving deeply into understanding what systems are in place, what policies are in place, and what is missing. In addition to the work we're doing in Europe, we are studying 9 Asia-Pacific countries as well, to really get as big an understanding as we can of the opportunities for improvement, how patients can be better treated, better impacted, and experience better outcomes.
Why is lung cancer a strategic priority?
In Europe, the death rate for cancer is, for cancer in general, but for lung cancer in particular, is a huge need. 20% of cancer mortality in Europe is due to lung cancer. That is the same mortality as breast, colon, and prostate cancer combined. So that relates to 1 in 5 people who die of cancer in Europe die from lung cancer.
Which would be the challenges for Romania, as you identified in this study?
Well, the first thing, and I'm really delighted to be here today because I've learned a little bit more how things have progressed since I was here in March for the workshop. Romania doesn't have a national cancer control plan. And we want to see countries have a national cancer control plan because that is the way the government can communicate to the people that cancer is a priority for their country. So not having one is an opportunity, because by creating one, then we can start to address the issues. There are certain components that we look for in a national cancer control plan. The first one is that it is updated every 5 years. Why every 5 years? Well, that's because in that time period, we will have a number of scientific and medical innovations come along, and we want to make sure that the national cancer control plan of each country is updated in order to take advantage of the new understandings that will emerge. We also want to see that there is a solid implementation plan, so that there is a stepwise approach to making sure that it can be operationalized. And most importantly, perhaps, is that the National Cancer Control Plan has a source of funding, a dedicated source of funding, because it's the funding that ensures that it can be operationalized.
You mentioned that lung cancer is a race against time. Yes. How would you comment on that, and why should be early detection a priority?
Early detection is key, because with anything, if you discover it earlier, you have a better chance of putting in place the right diagnostics and the right treatments that can best impact the outcomes. Unfortunately, lung cancer is a difficult disease to detect early, and all too often patients are diagnosed at the very end stages of the disease. And so any of the treatments that we have available, it's hard for them to work. So we want to see earlier detection because we want to improve the patient's chance for survival.
How important would a genomic national strategy be, for example?
Well, I think that's a good approach. First, I think the first thing, though, is to get a national cancer control plan in place. And then to consider perhaps whether, in the case of Romania, whether a lung cancer specific plan would be useful, because then that's further focusing attention on the problems faced for people with lung cancer.
The importance of disease registries was also a subject today. Is that a challenge for Romania?
It is, because Romania's cancer registry really needs to be improved. But again, this is a very good time to be addressing this, because a number of other countries that we have studied are putting in place new initiatives and new ways of gathering data and ensuring that a more complete picture can emerge. It's important. We found in talking with clinicians throughout Europe that a clinical cancer registry can provide a lot of good insights into how patients are treated, which can then positively impact the care a patient will receive today or tomorrow. There is a new health data hub that is about to be launched in France, and I think there could be some really good learnings that might help Romania chart the path forward.
All aspects of cancer care were discussed today, including the psychological approach to a patient. How important would that be in your opinion?
Lung cancer has a unique psychological burden. It is so crucial that patients are able to obtain the care that they need, that the burden of cancer, the burden of lung cancer, be recognized in the clinical guidelines, because there's tremendous stigma about this disease. Patients themselves feel it, and I've heard some heart-wrenching stories of patients who have been reluctant to go to their physicians, although they've suspected that something is wrong and something is not right, and they're reluctant to go forward because they feel guilty about potentially having inflicted this disease on themselves. And I've heard that sometimes clinicians look at their patients with a sense of stigma. We need to come to terms with this, and we need to eradicate stigma from the whole discussion, because patients, there are diagnostic and treatment opportunities out there. Patients need the care, and they need to be treated with compassion.
There is this discussion, this initiative of a European cancer control plan. What impact would this have on countries like Romania here in Central and Eastern Europe?
I think it can provide a good guide to help a country move forward, but it's really got to come from within a country. So yes, there's a top-down approach coming from a European level, but it also has to be bottom-up, because people have to buy into it. People out in the street have to understand that they have a role to play in their own health, that they need to be able to maximize their own health. They have to understand the role that they play in ensuring that they have a healthy life. Clinicians need to be able to recognize disease earlier in the process. Health systems need to be able to ensure that the diagnostic and treatment modalities that are available are available to patients who need it. And governments need to be able to help their citizens achieve healthy lifestyles.
And how would you comment on the importance of a personalized medicine approach, not only in lung cancer, but in oncology as a state of care?
Personalized medicine, when you talk about the patient involvement, there are different ways of defining personalized medicine. So I'm going to answer your question from the standpoint of patient involvement. It's crucial, because the best outcomes are achieved when patients are part of the process, because it's their bodies going through this journey. Shared decision making is so important, because if you inform a patient about the options, about what the treatment path looks like, they have some knowledge about the road ahead, they feel part of the process, and if they can have some role in making decisions that are impacting them, it's so much better.
So to sum up, in your opinion, which would be the key priorities for Romania on the short and long term?
I think the key priority, immediate priority, is a national cancer control plan, because everything will be structured around that. And then improving the clinical guidelines to make sure that the patient's voice is heard, that they're considered in the development of guidelines because they have such an important role to play. I think the idea of ensuring that there are sustainable solutions in place and equity of access.
Thank you so much for all these messages. More details you can find on Raportuldegarda. Thank you.
Mulțumesc!
Mulțumesc!